my name is Dr. Caroline Juguna from Afya Buzz. Today, I'm joined by a beautiful doctor all the way from the UK. Natasha, welcome to the show. Tell us a bit about yourself.
Sure. Thank you so much, Dr. Caroline, and thank you for giving me this opportunity. So my name is Dr. Natasha Kapoor. I'm a PhD by background, PhD in diabetes and obesity, and worked as a medical advisor for 4.5 years with a pharmaceutical company back in the UK. So yeah, that's a bit about me.
From your qualification and your experience, you're definitely the right person to help us gain insight into our topic of today. And to start us off, we'll talk about diabetes.
Sure.
And maybe before we start, Doc, you could tell us what inspired you to go into the area of diabetes and obesity.
Thank you. Right. So when I was doing my undergraduate degree, I got really fascinated with endocrinology. And while I was studying, I realized that how much of an impact weight and diabetes has had on my own family and Asia as such. And so is it for Africa. It's a massive health issue. And just looking into that and how little changes can actually impact that really made me want to go ahead and just learn more about it and just make that little impact in society in any way I could, because for me that was very important that I help people. So and yeah, that was how I got into it.
Also the interest in endocrinology and also having people close to you being affected by diabetes and obesity. And when you talk about endocrinology, for those who are watching and they're wondering, what is this scientific word? What is endocrinology?
So it's just, anything that goes wrong with your endocrine system, so hormonal changes and all of that, the big massive world of diabetes, of thyroid, things like that, which are more hormone related issues, kind of encompass the study of endocrinology. So your diabetologist is also known as an endocrinologist.
Oh, wow.
So just the way their training is. So it's just a specialization, like you would have oncologists for cancer, similarly to that. So that's a scientific term for it.
So anything dealing with hormones and big in that area is diabetes.
Yes.
So we can start our discussion from there. I know many people know there's type 1 and type 2 diabetes. And you can help us, differentiate what is type 1, what is type 2 diabetes.
Right, so I think I'm going to start with type 1 because I think it's probably easier to define. So type 1 is probably diagnosed early on in childhood because that's where your pancreas, which produces insulin that metabolizes your sugar, is just impaired, and you do not produce enough insulin, so you can't break down that glucose. So that's what happens. So those guys, at the start itself, we have to give them insulin, and they're insulin dependent diabetics. Type 2 is a bit different. Type 2 is where your pancreas are working, your insulin is producing, but you have resistance. Your body is not actually using that insulin to break down that sugar and use it as energy, which is what we need. And type 2 diabetes is sometimes caused later on in life. We do see now a lot more adolescents start having type 2 diabetes, but that's a lot to do with unhealthy lifestyles, weight gain, fats around your pancreas, that are stopping that insulin from coming up and making your body resistant to that insulin. So that's the key difference between the two.
And when it comes to the symptoms of diabetes, what are the common symptoms?
So a lot of increase in fatigue, increased urination, you would see, feeling very thirsty. That would be the key kind of things. Just basically, if you're eating a big meal and after that you feel quite uneasy, that's because your sugar levels are very high because your body is not breaking that down. So that would lead to kind of, and even sometimes blurred vision because of that. So if you're having any of those symptoms, you have to go to your healthcare professional and seek help. So those would be the earlier signs of diabetes.
And we at times get people who have absolutely no symptoms and they're diabetic.
studies shows us is that the complications of diabetes start before diabetes is actually diagnosed, and it can go as up to back as to 10 years. So it's just important to maintain that lifestyle and kind of go in for your yearly checks to just make sure that your blood sugar is right. So yeah, it is. So it's good to be on top of your health checks for that reason.
So what you're saying is that there are people who do not have any symptoms. They don't feel sick. They don't feel fatigue. They just feel okay. Yeah, they could be diabetic for years. And to prevent this, then it's good to always have regular checkups.
Exactly.
Just to be sure that you're okay.
They wouldn't. Yeah, I wouldn't say you would define them as diabetics because their levels won't be that of a diabetic, but the body is already starting. The insulin resistance at a small level is already starting. So it's just better to get those checks done earlier on. They won't be that alarming, but you would at least be entering that pre-diabetic stage. So it's better to do that and be on top of the health checks.
Yeah. Yeah, you've mentioned pre-diabetes, Dr. Natasha. Please tell us, what is the difference between pre-diabetes and diabetes?
So we have key indicators called HbA1c, which is basically the amount of sugar in your blood, and gives us an indicator over the 3 months how much it has been. So we have defined targets for that. So if you're between, if you get to the above 6.5% of that, you are diabetic. But if you are between 5.7 to 6.4, you're a pre-diabetic. And the reason of that is just that the complications and how they start, and how over the years we've done enough research to understand that how that has an impact on your kind of overall health and your complications. So that's the guidelines that we have for that. So that's why we define pre-diabetes and diabetes, and it's easier to manage pre-diabetes. You don't go on medication during pre-diabetes. We only ask to make lifestyle changes, and we can basically stay in that rather than going on to the diabetes. And, it's just easier to manage for you because one's not taking medication. And it's also easier on the healthcare system because, you're still managing it by yourself. So it's easier to stay in the pre-diabetes stage. It's still very, you still should go in for your checks and make sure you're not tipping into the diabetes.
This is picked at the pre-diabetic. Through lifestyle changes, as you said, you're able to stay there and not move to the diabetic side.
Exactly.
And when we talk about lifestyle changes, what do we mean?
So we mean things like at least 30 minutes of physical activity in a day. And I'm not talking about just take a stroll down your compound or just around your house, but proper, brisk walks or just any kind of dancing or things that you enjoy where your heart rate actually goes up. So that would classify as significant 30 minutes of physical activity. Also, having a good diet, so a very balanced, healthy diet that you kind of have every day, and not just that you have good meals for 5 days and the weekend you just binge eat or eat unhealthy foods. That's not going to help. But just maintain that healthy lifestyle throughout your things. So I think physical activity and a good diet really helps to maintain your pre-diabetic stage and not enter that diabetes stage. So
what does a good diet look like?
That's a good question, isn't it?
It is.
So the thing I opt for and what we have learned through research is a lot more of green leafy vegetables and a lot more of protein. So, we use the plate method back in the UK where it's 50% of your plate should look green. So should have your leafy vegetables, your beans, anything green that you can find. And then the 25% should be your meat. So have a good amount of meat. If you're vegetarian, go in for soy. So any proteins that you can find would be 25%, and the other 25% would be your carbs, which I know out there we are really hating on carbs in a way and saying that you shouldn't eat carbs, but they are the main source of energy. So, if you're doing a really massive physical activity and you come and back and eat just your meat and your vegetables, you're not going to feel that energized. You need the carbs, but just make sure that they are good quality carbs. So, opt maybe for your brown rice instead of your white rice. So yeah, I'm sorry if I probably, you can give examples of how that would define into an kind of African household and what kind of carbs you guys eat. But just to give context, so yeah, foods that have a, different kind of that it takes longer to break them down would really help because you feel fuller for longer. So those kind of white rice is easily absorbed, so you don't feel fuller for that long. So just those little tweaks can really make a difference.
Yeah, I know some of the local examples, as you said, brown rice becomes a better alternative to white rice. There's also brown flour, ugali flour. Ugali is a common meal for us. And also other things like sweet potatoes and arrowroots. That's undoma, ngwashe, that's how we call them here.
Yeah, definitely. Yeah, instead of potato, opt for sweet potato. Yeah, little changes like that.
And when it comes to fruits, are fruits okay for diabetic?
Of course they are, definitely we would say have fruits, but just kind of do your due diligence of just finding out how much sugars they have, because it's very easy to be like, oh, we're having a glass of juice. First of all, if you're buying it from outside, you don't know how much sugars have been added into it. Banana is a great source of very quick sugars, but I wouldn't recommend a diabetic patient to eat 3 bananas a day because that's going to really affect and impact their sugar. But if they're having a hypo, definitely have half a banana, see how you feel. There are certain fruits that have very high amounts of sugar, like oranges are fine, apples are still okay because also you're chewing the fruit, so you feel like you have eaten enough. Well, I would rather have you eat 1 apple, eat 1 orange than have a apple juice or orange juice, because your body will feel a lot fuller if you're chewing the apple rather than drinking the apple juice. So yes, fruits are good for you, but in moderation, as well as just make sure it's a quick Google. How much sugar does melon have? How much sugar. Fruits that have a lot higher water content is a lot better for you compared to others. Melon is actually fine. Yes, but watermelon has a bit more sugar than normal melon. So just things like that. So just to have a look around and figure out how much sugar it has and then tweak it accordingly. So yeah, instead of having half a slice, cut it shorter, cut it smaller, and have a tinier portion of it. So yeah.
There are times we have mango season.
Oh yes.
And we can eat like 5 in a day. What's your take on that?
Yeah, no. Mango does have a lot of sugar. So probably, if you are used to having 1 mango a day, maybe try cutting down to half.
To half a mango.
And then go down even more. And I wouldn't say cut it down, obviously it's a great fruit. I acknowledge that. It tastes amazing. I'm not saying that stop eating these things, but it's just about the quantities. So yeah, because you yourself will feel the difference. If you have 1 mango, your body's going to produce that sugar very quickly and you will feel a bit lightheaded and not blurred vision and stuff. If you only have a tiny bit of it, you'll be fine. So yeah, and your blood sugar won't spike that much, and you want to avoid those spikes. So
Okay. Something interesting you said that when it comes to fruit, it's better to eat a whole fruit than juicing it, especially when you're looking at the amount.
Yes.
And does this apply to the commercial juices or even the juices we make at home?
So definitely to commercial juices because we can't trust. When they say it's real fruit juice, if you look at the back, it will say this much amount of concentrate. And that just means that it's sugar. So if you look at that. At home, yes, you can, but I would still kind of recommend that you bite on the fruit and eat the fruit, especially you don't take the fiber out. So if you're making, if you're straining the juice, you're losing the fiber,
which is important.
Which is so important, which is what really helps you feel fuller and, kind of helps it get it out of the body as well. If you take that out, all you're left with is the sugar. So you have lost the good bits of the juice by mincing it. But I understand sometimes you just crave, have once or twice, but rely mostly on your main fruits and just eating them.
Okay.
Yeah.
And maybe blending would be better than juicing, because when you blend, then you have
everything's in there.
Yeah.
Yes.
Okay.
Yes. Yeah.
That's very insightful, especially when it comes to juices. I know we are not into the culture of labeling everything as it should be labeled. So people see packaged juices and they feel like this is a better alternative. But as you're saying, most of these commercial juices have a lot of sugar, more than what we need.
Yeah.
And you can't compare that with the real fruit. Yeah. I've seen conversations and people asking that, there's this new information that diabetes can be reversed.
Yes.
Is that true? Can diabetes really be reversed?
Diabetes can be reversed, but it cannot be cured.
What does that mean?
Exactly. So you can stop the medications by losing sometimes the weight. You cut down on your calories. You you do your physical activity. You lose the weight, or you're on weight loss medications, or you go through surgery. And then your body is actually producing enough insulin. It's breaking the sugars down, so it's fine. So you can. So what you do is you go into the pre-diabetic stage, but you still have the diabetes in your kind of history and in your system. So the damage has already happened. So that's why we say we cannot cure it, but we can reverse it. By reverse, we are just meaning we are going in the pre-diabetic stage. So when people say diabetes has been cured, no, diabetes has been reversed. So yes, you can reverse diabetes, definitely.
And what that means, as you're saying, there's still that risk. You're still per se sick, but you don't need medication to maintain your normal glucose. But through lifestyle, you're able to maintain a normal lifestyle.
Exactly.
Yeah? Okay. And from your own experience, do you have a story or a testimonial to just show that this is a reality?
Of course,
or is it just some theory from science?
Yeah. No, so obviously there have been a lot of clinical trials that I have been part of where I have seen success stories, but the one which really hits home is the fact that my father is a key example. So for the past 10 years, he has been in the pre-diabetic stage. He did go on to the diabetic stage. His HbA1c went up to 6.7, which would be classified as diabetic. And when he had his appointments with his doctor and his nurses and the dietitians, they said, well, first let's start. And we always start with lifestyle changes. So, and said, come back in 3 months and we'll do your HbA1c again. And he just started very simple things like 30 minutes walk every day, cutting down his alcohol, cutting down on the amount of sugars he took. And that was not just in amount of sugar in his tea or anything, it was also carbohydrates and moving on to healthier carbs. And over 10 years, he has lost 8 kilos of weight. Wow. And it was very, very gradual. And he made those changes. And he's now at a 6.2, 6.4 level, which is a pre-diabetic. Over the 10 years, he has never had metformin, which is the treatment you start people on when they are diabetic. And he leads a very normal lifestyle. So he has avoided any medications, and that's what you want to be at, really.
Oh, wow. So for 10 years, no medication. No. Just maintaining it with lifestyle changes.
Yes.
Exercise and diet. That's very encouraging to know that, this is not a story of someone you've had. It's actually your dad.
Yes.
When we talk about obesity, what do we mean?
Right. So it's clinically defined as if you are a BMI of over 30 and have impairment in health due to that